With us now is Vanessa, and we had the wonderful experience of bringing her to set on LiveItUp, and here she is today at the Expo. How's it going so far?
Oh, it's great. It's such an energetic event. I'm having a great time.
And what will your seminar be about?
Perinatal Depression.
Okay. And you are representing what medical organization?
Nassau University Medical Center in East Meadow.
Do you see that depression is on the rise because the economy and everything else is like so difficult right now at this time? Is it different than it had been 10 years ago?
Actually, I think that it's been in the same trend. Perinatal depression has always existed. It's something that parents are not comfortable talking about with their physicians or actually with anyone because of the stigma associated with it. So I'm here to really hopefully destigmatize some of the myths with perinatal depression and postpartum depression.
Everybody says that having a child is one of the happiest times in your life, but for some reason, because of chemicals and things like that, sometimes it's not for everybody.
Absolutely. Actually, having a child is a very happy time, of course, but often it's also a time of great turmoil where there's a huge adjustment, and all of those factors, coupling in with the sleep deprivation, it makes it just a really emotional time.
And I was very joyful having my children, but you know what it is when I had my first son, that moment that the baby is born, your life is profoundly changed. Instantly. It's like all of a sudden you are responsible for knowing where that child is 24/7.
Absolutely.
And I don't think anybody really prepares you for that. They tell you what to feed your baby, how to dress your baby, how to clothe your baby, how your baby should sleep, but they don't really mentally prepare you for that moment of transition. And it's a huge moment, a great moment, but it's big. So it's wonderful that you're there to help people.
I agree. 22 years ago when I became a nurse, and I was that new mom on the unit, and I didn't know what depression was. I didn't know it as a student. I didn't know it as a new mom. And 18 years ago when I had my first child is when I learned about postpartum depression because it happened to me. And for 18 years, this has been my message of hope that yes, you can come out of it and you can be well again.
That's so wonderful. Thank you for sharing your personal story, Vanessa. That's so great. So you were there. You understand.
Absolutely.
You can have empathy for moms.
Absolutely. I was actually there 18 years ago, postpartum depression with my daughter, and 4 years later, pregnancy depression with my son. So I've actually been on both ends.
Excellent. Well, thank you so much, and I applaud you for everybody that you're helping.
Thank you.
Wow, very cool. Stay tuned for more. The RN in the house, Vanessa. Thanks.